What are some of the drugs that you use or that physicians should be considering for their patients who really want to undergo real detoxification?
So if you're doing something like that, it's pretty important that you use a binder in your intestines, because there is a situation called an enterohepatic recirculation. So it gets something toxic gets processed by your liver, it gets sent out into the stool, and because of dysbiosis or bacteria that are there that can cleave off those protective things for your toxins, the toxins get wrapped up in a glucose molecule or something, those bacteria can cut that off, and that toxin can get reabsorbed into your body to have to be reprocessed. So imagine the drain of energy on your cells if that's happening. So again, I would think about using some sort of binder to prevent that from happening. Most of those binders are positively charged because most of the toxins are negatively charged. And so you can use things like charcoal, but prescription I use Welcol. We do this in our Lyme and mold patients to help them with clearing out those toxins so they're not reabsorbing things. We actually can use those in patients who have too much estrogen in their system, et cetera, because that enterohepatic recirculation is a problem that we can see. So there should be some way for you to be sure that as you're doing whatever detox is happening, that you're moving this along. Again, your physician should be able to help you with that.
So would you take charcoal once a day? Would you take it after every meal? I actually used charcoal 10 years ago to figure out, how long it takes for something from the minute I eat it till the minute I poop it out, because everyone has a different digestive motility cycle. And I'm a 24-hour. If I eat something in the morning, I poop it out in the next morning. So I'm pretty. I know that because I use charcoal. But how would I use charcoal as a binder if I'm starting to embark on this detox process?
So it would ideally be done between meals.
Okay.
Because you want to be sure you're not absorbing any of your important nutrients, things that you ate, things like B vitamins that are so critical cofactors in the intestine, in the liver for all the detoxification processes that the liver naturally does on its own. You want to make sure you're not removing any of the minerals that come out. So it would be done between meals. So you're and it would be done away from any supplements you might be taking. If you're taking a B complex or a multivitamin or something like that it would be done away from those.
Okay. Is bentonite clay also another good binder?
And pyruvite clay, and by prescription we use choleseverum. That's another really good. The nice thing about that is it's got a high number of binding sites. So if you're dealing with someone who's particularly ill from something like mold toxicity, then that's a better binder to use. It's just got more binding sites for the toxins. So that's where you would start after you decrease inflammation and improve their immune response. Now we would talk about how do we be sure that you're moving your bowels, and we say it is illegal for you not to have bowel movements at least once a day, and ideally 2 or 3 times a day when you're working with us. We also will give them other things to help their cellular function during that time. We'll give them, minerals and vitamin C and other things to help them during that time when they're getting their toxins pulled out from their cells. So you can use things. There's a lot of different things you can use to help with that pulling process. Certainly EDTA and DMSA or DMSO if you're doing it, or if you're doing it by IV. And you can use DMSA. And I'm kind of moving away from doing things IV, not because of safety or concerns particularly, mostly because most patients are able to get through it. If I fix all those other things, most people are able to get through it. So it's very rare anymore that I actually need to use IV EDTA. And DMSO, but you can also use those have them compounded in a rectal suppository or in an oral capsule, and those can be effective as well, especially if you're dealing with a more mild case. You can use those, or if you're just preventively. So, for example, if you're having your mercury fillings removed, you can use DMSA rectally in a couple days a week, and that can be helpful for getting them to detoxify, to pull that mercury out.